Welcome to PHI, Public Health Impact. I'm Cham Dallas.
And I'm Phaedra Corso. In today's show, we're going to be talking about health and risk communication.
Well, communication, as you know, is important in daily life because it determines really how much we learn and really how we're going to get along with others.
So I thought it would be great for us to start today's show, Cham, talking a little bit about our own research and how health and risk communication has impacted what we do.
Well, it's a fundamental part of emergency preparedness. Whether I'm speaking in front of the CDC, a major federal group, or in front of the students, we tell them how critical it is to be able to communicate risk without falsehood and without scaring people.
So I know that you have a certificate in emergency preparedness for the students. Do you teach anything particular to health and risk communication in that course?
We do. Every year we go fall and spring, in every course as a matter of fact, we have a section on risk communication. How not to do things, there are the things you avoid, and then the elements that they really need to get into. It's a fundamental part of emergency preparedness.
Well, I'll give you an example of how I use risk communication. So a lot of the research that I do is asking people how much are they willing to pay to reduce their mortality risk, like having side airbags in your car as an example. How much are you willing to pay for those airbags? Well, when we're talking about the mortality risk, these risks are pretty low, like 1 in 10,000. So we've been really looking at how do you convey really tiny probabilities to people in a way that they can understand it. It's all around how do you communicate risk. And so we've found some pretty interesting things, that people love visuals.
Yeah, in some cases, if it's just a tiny possibility, who cares? You know, it doesn't even need to be conveyed.
Right.
Yeah, well, today we're going to have Dr. Karen Hilliard, who's an assistant professor of communication in the Department of Health Promotion and Behavior.
And I'm really excited that you've got Dr. Vicki Freimuth coming in today as well. I actually knew Dr. Freimuth from her work at CDC a long time ago, and she right now is the director of the Center for Health and Risk Communication on campus here.
And we'll have the student perspective as well with Lourdes Martinez-Cox, a doctoral student here in the College of Public Health.
Together, these three experts will show us how important risk communication is in our lives, and especially in public health.
With us now is Dr. Karen Hilliard, an assistant professor in the Department of Health Promotion and Behavior here at the University of Georgia College of Public Health. Today's show is on health and risk communication, so set the stage for us, Karen, about what really does this refer to and how does it differ from regular communication?
Okay. Well, communication about health takes place all the time, all around us. Every time we talk about health, when we learn about health, that is health communication. So it's everything from conversations that you have with friends and family, conversations that you have with your doctor about treatment protocols, and all the way up to mass media campaigns about health. All of that is health communication.
So the right type of communication can be an effective tool for public health and preventing illness and injury. What specific areas are you dealing with in your research toward that end?
I've been looking at vaccine behavior and decisions that people make about getting vaccines. And those decisions are really complicated for a lot of people because there's a lot of confusing information out there. A lot of it is inaccurate. It may not be based on good science. And so what we want to help people do is be able to make sense of that information, to sort through the good and the bad, and make decisions that are going to help keep them healthy and keep their family, their friends and neighbors healthy as well.
So essentially, you're talking about insights that you're going to give us and others about communicating that plays really key roles in decision making. And the example like you just brought up in vaccines.
Right, because people are concerned about the risk of disease. They're also concerned about the risks of vaccines. And what they really need help in is deciding which makes more sense, which is riskier. And for example, when it comes to flu vaccine, we know that upwards of 30, 40, 50,000 people die each year in this country alone because of seasonal flu. We have a vaccine that's readily available that will help prevent many of those cases of flu. And we'd like to help people know about that vaccine and make the decision that that vaccine is going to keep them healthier and going to save lives.
So from your research, is there a difference between vaccine behavior during a pandemic and vaccine behavior for more routine types of vaccinations?
Well, we don't have very good data about a very severe pandemic, because the pandemics that most of us who are living now have experience with have been really rather mild ones. But if we're talking about a pandemic at the level of what happened in 1917, 1918, the so-called Spanish flu that killed millions of people around the world, it's a very serious thing. And so we want people to understand flu has serious consequences. We want people to know that a vaccine can help prevent flu. That's the same during seasonal flu. Even when fewer deaths might result from flu, vaccines save lives.
So we've actually learned something from those earlier severe epidemics that are helping you now.
Yes, although there are new developments in the area of vaccine that are somewhat troubling, actually, and it surrounds this decision-making process. We have a lot of people who are very concerned about the risks of vaccines, and certainly vaccines are not without risks, but the benefits of a vaccine typically far outweigh any risks, and the risks of many diseases are far more serious than I think a lot of people realize who haven't lived through polio epidemics or through some of the childhood diseases that used to kill many children before they reached adulthood.
Well, of course, lately we've been hearing a lot about parents and others refusing to vaccinate their children or to vaccinate themselves. This seems to be a growing phenomenon lately.
It is, and it's very disturbing, because vaccines have really been considered one of the greatest public health victories ever. And now we have a growing trend, hopefully not growing too quickly in this country, where some people are concerned enough about vaccines that they may refuse all immunizations for their children. Now, it varies from state to state, and in some states the laws are a little easier to get around than others. But we have some places in this country where up to 30% of children sitting in classrooms in schools are unvaccinated. And that's not just a danger to those children and those families. It very much affects the children who they're sitting next to, who've had all of their vaccines, but in some cases the vaccines may not stick, and sitting next to an unvaccinated child may put them at great risk.
Yeah, I think that's almost certainly what we will be seeing in the future, pending more interventions on our part. Are you planning to take any other research that's going on that might be useful to public health communicators and others involved in health risk communication?
Well, I think there's a lot that we can learn. We're just beginning to explore this vaccine issue, and I think there's a lot that we still don't know, a lot we can learn. What researchers like me want to know is, who are the people who choose to vaccinate versus the people who don't? What differentiates them? What influences their decisions? Are they influenced by the advice of their doctor? Are they influenced by what they see on TV or what they read on the web? How can we help them get accurate, credible information and make a decision to vaccinate? So we're still learning what the decision-making factors are, and from that we can hopefully develop better messages and better information for people that will lead them to make the right choice, which is the choice to receive vaccinations.
A great example that information is power. Thank you very much, Dr. Hilliard.
Thank you.
We now have the pleasure of being joined by Dr. Vicki Freimuth, Professor and Director of the Center for Health and Risk Communication here at the University of Georgia. Welcome, Dr. Freimuth. I'm glad we finally got you on the show.
Thank you.
You've had quite an interesting journey in this field. Why don't you tell us a little bit about that so people can see the interrelationships in health and risk communication?
Be happy to. I actually started in this field as a professor at the University of Maryland when the field was really starting in the 1970s, and worked there for almost 20 years doing very applied projects as well as academic projects. And then I had the good fortune of going to the Centers for Disease Control. A lot of people know it as CDC. And there I was director of communication for about 8 years. Very exciting years at the CDC, where we had the anthrax attacks and West Nile virus and a lot of interesting things. And then I came back to the University of Georgia.
Well, I have a copy, a big, thick copy of your risk communication manual in my Emergency Preparedness Center. And so how does that role of communication in public health, how has that really changed in this last number of years, this active period that you've been referring to?
Well, I think the good news is that I believe public health has grown in its appreciation of communication, although I would say there's still some way to go there. But I think there's a recognition that there's so many channels of communication. The public is such a consumer of health information that we need people who specialize in looking at the best ways to get accurate information to people.
Would you say that this change has been incremental or has been more sudden in nature?
I think it's been incremental, but I think some of what I call the communication revolution that we're living in with the advent of the internet and all social media has been a huge force, and in a way it's just exploded, sometimes for the better and sometimes for the worse.
Well, we've been speaking on this particular episode about the very complex and changing issue of vaccination. What is your take on the best way to communicate with the public on this issue that seems to be increasing in concern for the general public?
Yes, it is, and I think it's a very important issue for us as health communicators to look at. Well, I think first of all, we have to communicate about it frequently. One of the things we forget is there are a continuously changing group of people who are making this decision. So our communication has to be out there all the time. It has to be accurate, it has to be simple enough that people can understand it. And maybe most importantly, it needs to come from people that the public trust.
I mean, you've had this 10,000-foot view, you know, because you've been at the CDC and you've been in the field for a long time. What are the next steps that ought to be done now in the future going forward? What future research is really going to be necessary to improve in health and risk communication?
Well, in terms of vaccines, I think unfortunately we've done a fair amount of research, but we still don't really know how people make those decisions. We have thought it made a big difference what demographic group you were in. We're finding that's less important. We've been doing some research looking at trust and the role that trust plays and how very important that is. And what we've been discovering, which I think is an exciting new area to look at, is the importance of friends and family. And what are other people doing in terms of vaccine, and what are they telling us we should be doing? And social media plays into that, obviously, as well. So that's an area we're exploring, and I think could be very productive.
Well, the Center for Health and Risk Communication, you're the founding director. What is the overall objective and mission of this center?
Well, the center was really developed to kind of provide a focal point here at the university for people across many disciplines who are interested in health and risk communication. And what we're trying to do is foster more research, and research that really can make a difference, even for the citizens of Georgia. So a lot of our projects actually focus here in the state.
And this is an interdisciplinary effort.
Very much.
I've been director of interdisciplinary research for decades, and you certainly have a believer in me. But tell us, and tell the people that are watching, why is interdisciplinary research so important?
I think one of the reasons is that public health problems are very complex and they're very challenging. And we need people coming from multiple perspectives and multiple levels of expertise to together address one of these problems. We learn a lot from each other. CDC, where I worked, is probably one of the most multidisciplinary organizations that exist. And they work effectively together in teams to solve public health problems. And that's what we're trying to do at the center.
So interdisciplinary research, that means a lot of disparate teams of different kinds of experts in different silos, as it were,
Yes.
Having to cooperate across these borders. Getting these people to work together to solve these public health issues, it's tough sometimes.
Yes, it is tough because you have people from disciplines that are very different. You have epidemiologists, you have basic bench scientists, you have the social scientists looking at health behaviors, you have communication people, economists, public health law people. But I think what makes these teams work is that people have a dedication to solving a problem. They are willing to leave their silos. And they each have something that they can contribute to this complex problem. Most of these problems don't have a single solution. We would never argue that communication is the only solution. We know that we have to change the environment, we have to change policies, we have to change practices that people engage in. So all those take different levels of expertise to do it, and I think a willingness to work in those interdisciplinary teams.
And some of these teams have different cultures as
Absolutely.
well. One comes to my mind is the security culture, the people
Yes.
with guns, and the public health culture. I like to think of them as the do-gooders. And they just sometimes they have such different cultures. Sometimes they don't get along that well. And but communication then becomes that gap, or the way of crossing that gap between different cultures, getting
Yes.
people to get along who might not get along normally.
Right, and there's a whole branch in communication that studies just this, and studies it in a medical environment as well. You know, you have teams of nurses, doctors, lab technicians, etc., who work together to solve patients' problems, and they too have to have training to figure out how to work together effectively.
Well, I think interdisciplinary research is exciting, and I appreciate you
Yes.
making that sound so exciting to the rest of us. Thank you. Dr. Vicki Freimuth, Health and Risk Communication. With me now is Lourdes Martinez-Cox, a doctoral student in the field of Health and Risk Communication. Welcome, Lourdes. Thank you for being with us today.
Thank you for having me.
Tell us a little bit about why you would choose to pursue studies in Health and Risk Communication. What would draw you to this field?
Well, it started off fairly early in life. My parents are Cuban immigrants, so when I was growing up, they didn't speak the language. So I was often placed in a situation where I had to translate either documents or doctor's visits with them. So by just experiencing that, it motivated me to want to do more and enter the field of health communication and education.
Well, right now you're working on your doctoral dissertation. I
Yes.
have great memories of doing that myself decades ago. But what is your specific focus of research in health and risk communication?
I'm particularly concerned with how physicians communicate with Latino parents in particular, specifically on the HPV vaccine.
So how are you approaching it as a research study?
Right now, as I'm designing it, the ideal would be to sit in the room and listen to the conversation that's occurring. But often we know that that is a very intimate setting and it's not something that someone can sit and observe. So what I'm trying to do is interview the physicians and the parents separately to really understand and get at the nuances of how that communication occurs.
Yeah, well, vaccines are, like we were discussing earlier in this episode, is really it's really, there's a changing paradigm here in the way that some people even feel threatened, you know, by vaccination. So why are you specifically looking at HPV vaccine in particular?
HPV has been shown, or the human papillomavirus specifically, has been shown to cause a majority of cervical cancer. And we take for granted in the United States, because we have the Papa Nicolau, the PAP screening for over 60 years, that cervical cancer is not a problem. But it really is very highly prevalent around the world. So now that we have a vaccine that can prevent cervical cancer, it's one of the things that it's a public health priority for us to follow up.
Well, does the issue of HPV vaccination present any special communication or any other problems for this?
One of the biggest challenges I find that we're experiencing is in communicating to parents that it's not about sex, that it's more about preventing cancer. And oftentimes, because we're giving this vaccine that is preventing a sexually transmitted illness, which later leads to cancer or may lead to cancer, that's really where the concern and the communication barrier may occur.
You know, Lord, there's been a big increase in cervical cancer incidence by this transmission of this virus. It's been a big increase in the incidence lately, and yet with the vaccine, it seems to be very effective in stopping that explosion of cancers.
One of the things that's exciting for us is that the Healthy People 2020 goals are looking at girls between the ages of 13 and 15 that have received the vaccine. And the vaccine is 3 doses, so we're asking them basically to come back 3 times to get this vaccine to obtain the full effectiveness that it offers. However, some studies have shown that just receiving the first dose is protective to some degree. But in any case, what we're trying to do now is monitor, because these vaccines became available for girls first in 2006 and then for boys later in 2009. So it's still fairly early to really tell the impact that it's had on curbing diseases such as cervical cancer, for example. But given the efficacy that has been shown in the research, we're very confident that it will be fairly high once we start vaccinating more young women and men.
Are we having better efficacy in getting males to take the vaccine than females?
Recently, just in October of 2011, we found the recommendations came out more forcefully for boys. And this is a result of, again, more research showing that cancer caused by HPV is affecting males as well as women. So it has become, if anything, a support for health communicators to now say this affects us all, and we really need to be forcing the message so that people really understand what it is, that it is safe, and that it is something that can really help public health in the long run.
Are there differences among different groups of parents, different cultural issues going on with this?
I believe that there may be some cultural influences, but what we've found in reading the literature that has come out recently is that mostly parents are concerned with the safety of the vaccine and also concerned about giving a vaccine to children who are 11 and 12 who they perceive are not sexually active at the time.
Well, finally, Lourdes, as a doctoral student yourself, you're a student yourself, what advice would you give to someone who's considering a career in health communication? What would you tell them?
I'd say that it's an exciting time. There's so much that we can do as health communicators. Not only is the field growing, but also technologies such as social media are allowing us to reach so many more people and really getting into their homes, into their daily lives, where they can communicate and have a conversation about their questions with us.
No, thank you.
Thank you.
We're back with Dr. Karen Hilliard, and I just thought we needed to talk about costs. We're in a budget contraction period. That's what's on everybody's minds. How do we deal with that in health communication?
Well, I think it's easy on the surface to think, oh, well, we can easily cut out the communication part of this budget. That's not really important. That's not what public health is all about. But actually, the data shows us something quite the opposite. We know that better communication, earlier communication on all kinds of issues not only saves a great deal of money, but also saves lives.
Well, what's an example of that? Give me some specific examples, particularly when we're talking about life as an endpoint.
Okay. Well, when it comes to life, and I think there's first the humanitarian appeal of this, but then there's the dollars and cents appeal. When we look at lives that could be saved, the National Cancer Institute, for example, has estimated that 50% of cancer deaths could be prevented if we simply used existing technology and knowledge that we already have. And the key to that is communication, letting people know what's out there, helping people understand that mammogram is an important screening test that you should get. What we want to see is people taking steps to get screenings and to make good health choices that can actually prevent diseases before they happen, rather than coming to the healthcare system when they're already very sick or very unhealthy with either a chronic disease or a fatal disease that's going to cost all of us, the people who pay insurance premiums, hospitals, doctors, and the government, more money. That's a way that communication and teaching people, educating people about health can save us all in the long run.
Yeah, that must be particularly so when you're talking about end-of-life issues. We all know that the famous statistics that the vast majority of the money that's spent on health care in a person's life is often in those last several months. And certainly that's an area where if you're going to reduce it to cost and benefit only, health communication must be critically important then.
Right. And it's something that we need to educate the public about, certainly, and I think we're thinking in terms of choices that the public makes, their decisions to get vaccines or to get screenings. But it's also very important for us to communicate with policymakers about the implications of some of their policies, the implications for lives that can be saved if policies are put in place that make sense, and of course the implications for our healthcare system overall and controlling the rising cost of healthcare.
Now there's a challenge for you, communication to the policymakers and the legislators. Thank you very much, Dr. Karen Hilliard.
Well, we certainly hope you enjoyed our show today.
Yeah, I really appreciate the fact that our guest explained this really critical field of risk communication to us.
Yeah, I think they showed that everything we're doing in the College of Public Health, the research that we're doing, it's all about being able to communicate that research to the public to make them informed decision makers so they'll do the right thing, they'll take action.
Or the actions we don't take. Inaction has serious consequences, such as the examples we had of people reluctant to follow through on vaccinations. That's inaction that has a big consequence in public health.
And you know, adding another whole layer of complexity to this is that we have language barriers. And so how do we communicate when you don't speak the same language I speak, as an example?
And finally, cultural barriers. We talked about the cultural barriers not only between different language groups, but between occupational groups where people just can't get along, and we have to use communication to bridge that.
Or in health policy, we would say the differences between political parties also is a challenge when it comes to health communication.
Yeah, especially this year. Yeah.
Exactly.
Yeah.
So thank you again, and we'll see you next time on PHI Public Health Impact.